Assalamualaikum warahmatullahi wabarakatuh. Hello guys, how are you today? I hope you are with health situation because in this situation is very dangerous. The dangerous is cause coronavirus. Before that, I want to remind you about keep healthy, like using your mask and hand sanitizer and then wash your hand. Before that, I want to presentation about my journal international. And I want to introduce myself. My name is Sahara. I am from Social Science Education with number present 360-141-9007 at Faculty of Social Science at Semarang University State. And then I want to presentation about my recent journal international with a little evaluating progress toward health coverage in Ukraine. And my presentation will given 4 parts. First is abstract. Second is background. Third is contents. And the last of my presentation is conclusion. Abstract. The last political revolution in Ukraine once again opened up the possibility of implementing a project of deep modernization the Ukraine state. The transformation of the health care system began to develop gradually with a focus on primary health care. Significant progress has been made over the past few years towards a human-centered model for the provision of health service, like set a new rule or new service system in Ukraine health. And then second, I want to presentation about background. If you want tell about or telling about background is not far from historical. The Ukrainian healthcare system is characterized by organization and financial inefficiency. Inadequacy to the population health need, the lack of deeper reform tough the post-communist transition. In recent years, private cost has 45% of total health costs. All of this has reflected in the low level concordance to health need of individuals and groups, which in turn leads to deterioration in the health status of turn leads to deterioration in health status of many population. The system is characterized by low rating, not only in terms of health outcomes, but also in terms of access service. All of the has reflect in the low level of concordance to health needs of individuals and the low level of concordance to health needs of groups, which in turn leads to deterioration in the health status of the country's population. Ukraine health sector in exacerbates by their inefficient, like make other person with low budget cannot to get medical when other person like sick or flu and other situation. If you get money, you get medis or medical, but if you don't have money, you don't have your health or medical. It's so bad. And then third, I want to tell about content. The contents of Journal International. The healthcare system of Ukraine is characterized by low ratings. Oh. The Ukraine healthcare system is characterized by organizational and financial inefficiency. Inadequacy, the population health need, and the lack of deeper reform in efficiency. Private costs has reached 45% of total health costs. All of the reflection, the low level in health of concordance of health needs of individuals. Evidence has shown the lack of public research in the Ukraine health sector is exacerbated by their inefficient use. Progress toward universal health coverage in Ukraine. First, the health financing system was diagnosed in 2017, and then the Ukraine health care with step by step and with background historical politics. When the parliament and the cabinet of ministers approved decrees that increase the financial and managerial freedom of Ukraine stated or freedom of the region and hospitals. The process of creating in the National Health Service has begun. We should radically change the financing system, focusing not on the beds, just focusing with the money, income, but with low rating because the service is so bad. And presentation about conclusion. The conclusion of my journalism international is over the past few years, the government of Ukraine has made significant strides towards a human-centered model for the provision of medical service, like new rules and toward progress towards the Ukraine health with evaluating and using step by step. And then in this conclusion is retell about organization in Ukraine, but the procurement of medicine through international vital medicines to people across the country. The reform project apparently was thought out in a reasonable amount of time and had to be complete within a few years. Like new rules to make people can get medical or medicine when the people sick or like bad situation is can to get medical with low budgets, because with new service like a financial or new service with financial and new medical service or profession of medical service. Okay, I think that's all. Thanks for your attention about my journal international. Okay, thanks for your attention. Wassalamualaikum warahmatullahi wabarakatuh. Bye bye. Keep healthy, guys.